Okay, recording.
Okay, good afternoon, everyone. This is Anna Swardensky, and I'm here from Cadre, and I would like to welcome you all to this afternoon's public health update for nonprofits. So today's session is designed to support you, our nonprofit service providers and community-based organizations here in Santa Clara County, as we continue the incredible work of meeting the needs of our community during these unprecedented times. We have structured this session in a meeting format, not a webinar. And so this will be an interactive time for you to be able to converse with us via the chat window, or if you have a question that you would like to speak aloud, please use the raise your hand feature or send me a private chat as the host, and we'll call on you when we get to the Q&A segment of today's program. Some of you are familiar with how Cadre runs our meetings, so thank you. If you could please type your name and the organization that you represent in the chat box, that will help our public health department speakers know who has joined, along with all of you, to see your colleagues that have logged into today's session. We are recording today's session, and we will make this available on the Cadre website after today for anyone who has missed the session live. We apologize in advance. The reason we're starting just a couple minutes late is we had a little hiccup with our live transcription service. So if there is someone that is hoping to utilize that, please send a private message to myself or Marcia, and we will work on that on the back end. But we normally have Otter AI running in the background for any accessibility needs. And so if you'll use the chat box, if you have any questions or need support, we'll do our best as the session continues. Moving forward, give me just a moment. Okay, so in March, when the pandemic began to hit us here in Santa Clara County, I don't think any of us really imagined where we would be today, nor would we have imagined that we have these overlapping emergencies and disasters that we have had to face over the past 6.5 months. On the screen here is a graphic that we created last month at one of Cadre's interagency coordination meetings to illustrate the myriad of services that have come forward to assist our Santa Clara County residents in the face of this pandemic and the other emergency situations that we continue to face. We held meeting number 17 of our Cadre interagency coordination on this past Monday, and we want to start today's session off by applauding all of you for the good work that you've stepped up to provide as we all navigated this new kind of environment. Today's session is designed to help provide an update for you from our public health department. So I'm not sure how many of you remember or were with us, but back in April, actually on April 9th to be exact, just a couple of weeks into our county's first set of health orders, Cadre brought you a session called Coping with the Crisis that was led by Dr. George Hahn, our public health Deputy Health Officer, Director of Infectious Diseases and the Response Branch for our County Public Health Department. The objectives of that session when the pandemic first began are pretty similar to what we have planned for you today and that you see on your screen. We asked our County Public Health Department if they could please come back and provide all of you as representatives of our nonprofit sector with information on what they would like us to all know about the current situation. So what do we need to know heading into the winter cold and flu season? What are, who is being impacted the most by our pandemic, and how can we best serve our disadvantaged communities? How can we keep our nonprofit workforce well? What else do we need to know about current COVID-19 testing and flu vaccinations? and looking ahead, any information that can be shared on what's being planned for COVID vaccine distribution when a vaccine becomes available. And so without further ado, I'd like to introduce our speaker for today. We are extremely pleased to have with us Dr. Fenstersheib is a board-certified pediatrician who trained in Philadelphia and at the Milwaukee Children's Hospital, where he received his master's in public health from UC Berkeley and became board-certified in public health and preventative medicine. For any of you who don't know, Dr. Fenstersheib was the Santa Clara County Health Officer from 1994 through 2013. He is the co-founder of the Ira Green PACE Clinic at Santa Clara Valley Medical Center and has been caring for HIV-infected persons for more than 27 years. Dr. Fenstersheib rejoined Santa Clara County's response to COVID-19 in May of this year as the county's COVID-19 testing officers. And we are also grateful to our colleague Molly Carbajal from Public Health, along with Dr. Fenstersheib, who could be here today to speak with all of you. And with that, I'm going to turn the program over to Dr. Fenstersheib. Oops, we aren't hearing you, Dr. Fenstersheib. 1 minute. Okay, hang tight with us, folks. We tested audio, but we got a little hiccup. There you go.
Can you hear us?
Yep.
Can you hear me now?
Okay.
We can. Thank you.
Okay.
Sorry about that. I think we were, I don't know, it didn't look like we were on mute. But anyway, thank you all for having me back. It's good to be back. And I thought that I should come back to the county that I spent most of my career in and use some of that experience that we all get over the years to help out in any way I can. So it's nice to see the list of a lot of you that I remember from Cadre, and we spent many a good hour working on a lot of the emergency preparedness. So I'm going to give you what I think is an update on what we have so far, some of the new things, but I know I won't cover everything, and please, during the question and answer time, and I think you're going to put your questions into the chat. So as we go along.
Uh-oh, we lost your audio again.
Anna, can you hear us?
I can hear you again. I'm not sure what happened.
We're not seeing, can you move the slide, advance the slides? We're not seeing the advance. There we go. All right. Okay, well, once we get, this technology is all, we didn't do this 10 years ago. Okay, so all of you know that we've certainly seen a tremendous increase in cases of COVID. It's truly a pandemic affecting all countries in the world. Anna did mention that the last update was in April, so I thought I'd remind people the last time the health department provided an update, we had worldwide about 1.5 million cases, 88,000 deaths. And since then, in the 6 months, we've gone from 1.5 million to almost 38 million cases in the United States and over 1 million deaths. In the United States, again, we have nearly 8 million cases, and unfortunately, 217,000 deaths is the closest to date. We represent 4% of the population of the world, the United States, but unfortunately, we have 20% of all of the cases. So we're not doing a great job in our country looking at those statistics. Let's move on. So I wanted to present to you an curve of what our cases have looked like since early in the pandemic. And early in the springtime, we had an increase in cases, and then we did pretty well in June, early July, and then we began seeing the increase in the number of cases. So you can see that great spike. The good news is, though, since July and August, we've been seeing a steady decline in the numbers of cases. And so our case rate has declined in Santa Clara County, and we're very happy about that, but we're also very cautious, especially as we begin opening more activities and people are spending more time together. And we're concerned that we may again see a spike for a number of reasons over the next several weeks or several months. Let's move on. When we're looking at the numbers of cases and who's infected, we basically see that everybody is not infected or affected equally. And clearly, this is a trend map looking at the case rates among people in this county. And the top rate, which is in the green line, is the Latino population, the Hispanic population, and in the kind of the gold bar is the African American. So it's well above and has been well above, especially the Latinx community, all along in this pandemic, well overrepresented. In fact, Latinos represent about a quarter of the population, and yet at the worst of the pandemic was about 60% of our cases. It is dropping down, but there continues to be that disparity. Let's move on. This is hospitalizations. And again, early on, we had, in the early part of the pandemic, we saw very high hospitalization numbers. Things dropped nicely during the early spring, early June and early July. And then as the cases went up, our hospitalizations went up. But the good news again is that things are dropping. And so we've got plenty of hospital beds, we have plenty of ICU beds. But again, as we move, and we'll talk more about this, as we move into the fall and we enter flu season and other respiratory infectious seasons, then we are going to risk the numbers of hospitalizations going up. And again, with things opening up in our community, again, we expect to see a rise in the number of COVID cases. So we watch very closely the hospitalization rates, the number of beds that are occupied, and the availability of beds in our hospitals as well as the ICU beds. Let's move on. So the good news, this graph, this curve is going up and staying up, and that's a good thing in this case because this is our testing curve. And since the beginning, way back in April, we did very little testing in March and April. I think that's probably why they asked me to come on board to help out in promoting testing and getting testing going. So since May and through the summer into now the fall, our testing numbers have increased tremendously. So early on, we were trying to even get up to the goal that the state had for us, which was about 3,000 tests a day. And now we are well up over 6,000 tests a day, nearly reaching 7,000 tests per day. And that includes the testing that's being done totally across the county by the county and by all of the other providers. But that's a good thing because, again, the more testing we do, the more cases that we can identify, and the people that are infected can be placed in isolation and contacts into quarantine so that we can contain and try to contain the best we can the spread of COVID. The red line is the positivity rate. So of the people we tested, how many, what's the percentage of those that are testing positive? And you can see that there has been a steady decline since July, where our positivity rate is now down a little under 2%. So that's very good compared with a number of states. When you hear other states that are having a lot of cases and a high positivity rate, I think I heard some of the Midwestern states had high positivity rates as high as 18 to 20%. We are at under 2%. And the state, I think, is around 7% at this point. But the trend has been downward. That's good. The only caveat, again, I would mention, as we said, on an equity basis, that when we look at our Latinx population, especially, that the positivity rate has always been higher. It's been as high as 10 or 11% just a couple months ago, but it also has been trending downward, and now it's in the 4% range. So again, it's trending downward in the right direction, but it's still twice as high as the overall positivity rate in our county. Let's move on. So again, for a number of reasons, testing is important, and we'll talk about that a little bit in a couple minutes here when we start talking about the placement of the county in a tier system. But testing is readily available. We have good capacity in a lot of our sectors. Let's go back.
Sorry.
No, you're going the wrong way. There we go. Nope, there we go. So I just wanted, again, to show that there is a easy access point on our website at www.sccfreetest.org. That's easy to remember, Santa Clara County freetest.org. And you can easily find and make an appointment for testing, and also see the various locations for testing. So you can pass that on to your colleagues or to others that need to get a test. Our capacity, as I said, is pretty good. In fact, we're only utilizing maybe 50 to 60% of our capacity. So we have plenty of room for people to be tested. It's free. Some of these sites require appointments, others do not. Some are drive-through, others are walk-up, and all of that information is in our freetest.org website. Let's move on. As I mentioned, that our testing is available. One of our most popular sites is our Fairgrounds site. The testing is available there from Tuesday through Friday from 12 to 6:30, and then also on Saturday from 9 to 3. You do have to make an appointment, but it's very easy to make an appointment, and it is free. And when you get your test, you then will get a result back in probably 2 days now, I think we're running, and you can receive that result on your phone in a text or by email. Also, to mention here that we've worked very hard to get the other providers in our community to provide our testing to the community, especially our large health facilities, which were not providing the level of testing early on, but they're getting better. We did have to issue a health testing order, which affected the large facilities such as PAMF and Kaiser and Stanford and the other hospitals, to offer testing to those that are symptomatic, those who are known contacts to cases, and especially to those essential workers or those of you who are working in the public in areas such as groceries, restaurants, transit, and those types of areas where, again, you have increased risk because of your public-facing work that you're doing. And we want to make sure that testing is available. We recommend that if you are an essential worker, that you are tested at least once a month, and you may also test as often as every 2 weeks. No more often than every 2 weeks at this point, but at least once a month. Let's move on. So the state has given us guidance, and all of us have lived through being on various watch lists and what's closed, sheltering, slowly opening things. But the state has now come forward recently with a new mechanism of providing guidance and giving us a means for opening and following our trends through various metrics. and they call it the tier assignments. There's 4 of those, and they go from the most restrictive, which is a purple tier, through red, which is a little less, through orange, through yellow. And those are based basically on 3 different metrics. And I went over a few of them already. The first one is the case rate. So how many cases do you have? And they have a certain requirement in each of those tiers to meet in order to move to least restrictive areas. So that's based on case rate. The other metric is based on the testing, the amount of testing, the testing rate that we do. So how many tests are we providing to the community? And that's based on a rate per 100,000. And so that was a good thing, again, that we were able to increase our testing in this community because of the testing rate, we were able to then be provided an adjustment to our case rate. So if our case rate was too high to move into a category, but yet our testing was high enough to allow us to be adjusted down, that's what happened. So if the benefit of testing in some communities that was high allows the adjustment to be made downward. The other metric is the test positivity rate, and we've done very well in that area. They also have a new equity metric that we are able to utilize also, which basically looks at every county to see if they're actually providing testing and other, basically testing and guidance to those that are most in need. And that is determined by a specific equity metric that the state has provided to us. So we've done well in all of those, and we've been able to move from purple through red, and then just this week on Wednesday, we were able to move into the orange tier. So that's a less restrictive tier. And once you're in a tier, you basically stay in that tier for 3 weeks as the state then continues to monitor those metrics that I talked about. And as you improve, you can go to a less restrictive tier. However, if you don't do so well, you can also move backwards. And if we don't maintain those case numbers or the testing numbers or the equity metric, then we can be moved back to one of the more restrictive tiers. So we're in the orange right now, and it's really important for all of us to do everything that we can so that we can maintain our status at this point. Let's move on. So a little bit about this tier, this new tier, which is the orange tier. A lot of things are allowed. We've tried basically in our new order, the health officer's new order, to align ourselves most with the state guidance so that there's less confusion and less conflict in trying to figure out what is allowed and what isn't allowed in these various tiers. It's still confusing, and we have to look at the state, we have to look at our own tier. We're trying to do everything based on risk reduction, harm reduction, and use that model. And in some cases, we make things a little more restrictive than the state has allowed, mainly just to be extra cautious in our own community so that we can continue to improve and not have to go backwards in our tier. So these are some of the things that are allowed indoors, not everything, but this is in the orange tier what is allowed mainly by the state. In the red, I mentioned, I'm showing that we are a little more restricted than the state in these categories, and that's what appears in our in the health officer order. So if there's a state requirement and the county also has a requirement that's more restrictive, then you follow the more restrictive requirement. So for instance, an indoor dining is now going to be available to us in this community. We're very concerned about that, and we want people to be very cautious about indoor dining, and we'll talk more about those risk issues. But the state is allowing a maximum of 50% capacity. We in our order have been more restrictive, and so for indoor dining, it's a maximum of 25% capacity or 100 people, whichever is less. The same in movie theaters. The state is a little higher. We are more restrictive at 25% capacity in movie theaters, or 100 people, whichever is fewer. And also in places of worship, now we can move inside. The state is at 50%. We are cautiously at 25% capacity, or 100, whichever is fewer. I should mention, because I know a lot of people are concerned that these numbers aren't high enough and it's very restrictive. But if we aren't cautious and try to move slowly, as we've seen, we'll end up in a more restrictive tier, and then we end up closing everything up. And if you looked on the news lately, you can see that in a lot of the, as I mentioned, in a lot of the states, especially in the Midwest, some in the South, are experiencing new upsurges in their cases, and so they're in many cases are locking down once again, or they're in a situation where they're running out of hospital beds or ICU beds in their community. So we don't want to end up in that situation. Let's move on to the next slide. And I think I have some outdoor activities. Again, some new things under the orange tier. Bars where no meals are provided. We used to have a requirement that full meals were provided in order to operate outside. Breweries, distilleries. I would point out, though, that outdoor gatherings, the state has a little bit of a more restriction to us in this regard. So outdoor gatherings, up to 200 people are allowed, but again, you have to follow social distancing. So you may not have a space that can allow that many people because they have to be 6 feet apart. The state is being more restrictive, and so we must follow the state directive on outdoor gatherings as well as indoor gatherings. It still is limited, though, to worship services, cultural ceremonies, and that would be like weddings or funerals, and protests or political activities. And that would be such as an outdoor picnic, or say you want to barbecue at your house. Again, you have to be able to provide social distancing, and you can only have 3 different households. But that's a brand new directive by the state that was just, as I said, implemented last week. Let's move on. I know this is a lot of information, but it's all on the websites, the state and the county websites, for you to refer to. Again, we feel the highest activities at risk or for risk, it still include large concert venues or festivals, live theater, and the rest that I'm showing here. But again, these are going to be where you're going to have people just too close together, too many people, where, again, the risk of infection is just too high at this point. Let's move on. So I want to just, we follow a risk reduction philosophy in all of our orders, and it's all about transmission risk. It's not about the activity that we're looking at or the industry. We're looking at the actual risk of transmission no matter what we do. So just go through these because I think they're important. So ventilation is really important. That's why we say outdoors is much safer than indoors. Oops, we slipped ahead there. Go back.
I'm so sorry.
Okay. Outdoors is much safer than indoors, and that means that when you're outside, you're going to experience some breeze, some air movement, and because of that, we have a dilutional factor for any virus that may be floating around. So that's the reason for it outside. It dilutes those droplets, those aerosols, and the less likely then to cause infection. If you're indoors, good ventilation is really important. And so a well-ventilated indoor space is much better than a poorly ventilated space. Masks, of course, we all know about masks. We'll talk a little bit more about that. I have a slide talking about that. But everybody has to wear the masks. But they absolutely decrease the risk of transmission. And minimizing your contacts. So again, having small groups of people. That's why we basically talk about people in single households, even on indoor dining or outdoor dining. The people that are allowed to be at a table to eat are a single family. Again, minimizing your contacts. Density matters. The fewer people you have gathered together, the safer it is. Again, maintaining your distance and for shorter duration. So for all those reasons, you can evaluate a situation yourself by looking at those and applying those to the activity that you're looking at. And the more you can utilize all of those factors, the safer you'll be. Let's move on. And again, the indoor dining is one that we're just very concerned about. Again, it's allowed, but we want people to be really cautious and not to just run in to say, okay, it's allowed, it's open, it's safe to do this. We're allowing it. We don't feel like it is the safest activity. And certainly if you're a person at a higher risk for COVID, then you might consider not going to indoor dining. Again, why is it at risk? Well, it's indoors. So no matter what, you're not going to have quite the ventilation as outdoors. That's why outdoor dining was allowed first. When you eat, you can't have a mask on. We certainly recommend that you put the mask on as often as you can, but while you're eating and drinking, you're not going to have the mask on. So again, we're telling restaurants to do something to improve their ventilation, keeping people to one household to a table, limiting remember we talked about the capacity of 25% at a distance to make sure that tables are spread out. And then we have duration, eat quickly and leave. Well, we don't want to make ourselves sick eating the food, but we don't want to really spend a lot of time like we might ordinarily do in a restaurant. Let's move on. And then again, the masks and why do we wear masks? It benefits not only us, but the person that we're with. These are not N95 masks, so they are not 100% preventative, but they certainly prevent a large percentage of the air droplets, of the droplets and the aerosol spreads between each other. So again, everyone has to have a mask on. And the distance is important because a lot of those droplets will just drop anyway. That's where the 6 feet comes from. That most droplets, unless you're yelling or singing or screaming, will fall short of 6 feet. So again, duration of time spread, standing with someone else or speaking to them, both having a mask on, and certainly being at a social distance of 6 feet. Let's move on. So some questions have come up again of what's going to happen in the fall. Well, we don't really know what's going to happen in the fall. It's certainly a time normally where we see increased respiratory infections. We all get colds during the fall. The sniffles are a little cold of some sort. We also see influenza during the fall and winter time. And so we're highly encouraging flu vaccinations, really pushing that because we want to see if we can try to eliminate the amount of flu that we see this year for a number of reasons. One of them is a lot of people do get sick and end up in the hospital even with flu, and we've got to keep those hospital beds open. Number two, it's hard to differentiate between flu and COVID. We talk about cough, fever, shortness of breath. Well, if anyone has ever had the flu, they've had cough, fever, and sometimes shortness of breath. So it's not going to be easy differentiating between the two, but if we can get people vaccinated and protected from flu, we can hope to eliminate as many of those cases as we can. So please, everyone, get a flu shot. They're available at your providers throughout the county, and then certainly at a lot of the commercial pharmacies. But we also have them at our fairgrounds, and we're doing free flu vaccinations across the street from where we're doing the COVID testing. in the buildings across the street from the parking lot where the testing is. And we're there every Saturday. We'll be there through December 12th from 9 to 4. You don't need an appointment. And we will vaccinate anyone over 3 years of age. And that's me in there getting vaccinated just to try out the system. And it works. I was through there in a very short time. Okay, next. Again, this is just a quick look at other places where you can get a flu shot, the fairground, and then I list a few things, a few other areas that are available that the county is providing for no cost, no appointment flu shot. Let's move on. Okay, so I think the one other thing that I know was asked was about Halloween. So before, I don't have a slide on Halloween, but we do have some guidance out about Halloween. And clearly it's the same issues, just apply what I was talking about for lowering your risk of getting infected or your children getting infected. So we don't want to have any Halloween parties. We can't bring people together indoors or even any large groups outdoors because it's not allowed. Trick or treating, everybody wants a trick or treat. Again, there's some risk. We really aren't encouraging people to open up their doors to a lot of children, but it might be good for people to have their masks on, keep their social distance, and the kids perhaps can go up one at a time and then leave a bowl of candy at the entrance to the house or at the gate or somewhere so that we don't have to open up doors. Or just stay at home with your kids, carve a pumpkin, and watch a scary movie. That might be as good as it gets this year. Okay, I'll stop there and open it to whatever is next on the agenda, and I assume it's questions.
Yes, Dr. Fenstersheib, can you address, there have been a couple of questions about early on as we were changing tiers, there was a request to submit what at the time was called Appendix A or social distancing procedures or policies that needed to be submitted in the website. With the changes with the state coloring system, can you tell us what is necessary moving forward?
Yeah, I didn't mention when we were talking about with the new system and our new guidance out that the social protocols, the social distancing protocols that all businesses have had to submit have to be resubmitted. So, and I'm sorry I forgot to mention, I'm glad you brought this up. If you have never had to submit one, then you have 14 days from the time the order was issued, which was the 14th. So you have 14 days from the 14th to submit the plan for your social distancing. If you have already submitted one in the past, you may continue operating, but you have to get a new one submitted within that same 14 days. So either it's a new one and you have 14 days, but you have to have it in before you open. And if you're already opened and have submitted one, then you have to resubmit within the 14-day timeframe.
Okay, and there's kind of two questions that have been submitted related to this. One is, can you speak to who is allowed to open and operate? There was a time when it was only deemed essential services. If you're not a direct service safety net type of provider, are you allowed to open and operate your offices?
Yes, you are, but again, there is the requirement for gatherings. It has to be just the office personnel, and you have to basically maintain your social distancing and wear your masks. But again, there's a number of things on the website that can give you more information on actual business requirements. So those are on the website.
Okay, thank you. And Dominique was asking, is a submission on the social distancing protocols needed if you're not operating in person? And if things haven't changed with your submittal, I mean, your protocols, you still need to resubmit. Both those questions are kind of.
Yes. Well, if nothing has changed, you still have to resubmit. Sorry about that, but you still have to have one on file. If there's no people, I'm not sure, I don't want to not answer this correctly, but I think if there's no people involved, then there's no social distancing and you shouldn't need anything. I may have that all wrong and may not be answering what the question was.
Yeah.
But you definitely need to resubmit if you have one submitted. It needs to be updated. 14-day requirement.
Okay. Dominique, you put a question in. I'm not sure, was that a sufficient answer for you? You can go ahead and unmute if you still have a follow-up to your question.
I'm not totally sure. We are operating and have submitted our plans, but the services that we provide are online, and we're operating also offering a class outdoors in the park, socially distancing. So I guess that's kind of where my question is. We're not dealing with a building per se.
Yeah, but right. You still need to submit something because you do have an activity that's outside. So just resubmit what you did. If there's any updates to it, add those.
Okay,
Otherwise,
thank you.
Okay.
Okay. Dr. Fenstersheib, in the comment box, Teresa has indicated, we're being warned of a surge over the winter, and most states are now showing an increase in cases. Can you talk about the counties? She's asking, is it wise to move to orange even if our county is doing better? Oops, if you're speaking, we lost your mic again. Sorry. Let me see if I can. It doesn't.
Can you hear me?
Yep.
Okay, sorry. We have a little bit of technical difficulty with this particular computer, so I'm sorry if we kind of come in and out a little bit. Is it wise to move? We basically are doing the best we can, and certainly to keep our cases down, and it's a credit to everybody and everything that we've done. That's why I say that we have no control over moving to these tiers. I mean, it's like a two-sided sword. We want to make sure we stay safe, but yet we know there's a lot of impact on businesses and people's ability to earn a living and provide for their families. So we want things to open, but we want them to open safely. And we want people to use caution and certainly look at their individual risks and make their choices appropriately. But that's why we have, for the last several months, moved more slowly than perhaps other areas, even in our state, for that very reason. So we will continue to move forward for those reasons, but realizing that some people may be at higher risk and to take those precautions as appropriate.
Yeah. Katie, would you like to come off mic and go ahead and ask your question aloud, and then I'll go to Georgia.
Dr. Fenstersheib, this is Katie Waugh, and I am with the Cardiac Rehab. It's a program for, as you might imagine, people that are at risk, and most are seniors 60 or older. Mm-hmm. The cardiac rehab is something that is needed. So we're trying to figure out how far the stationary bicycles should be placed and how far you put people for stretching and that kind of exercise. So we're already on Zoom. We've been on Zoom since mid-March, but we do have some patients that would be best to put together.
Right, and you can hear me, right?
Mm-hmm.
I can hear you. And one thing I need to add is that this is a nurse observation over Zoom, but it is they have cardiac nurses standing by when the exercise is taking place in person.
So your mainly questioning is regarding the in-person activity, correct?
Yes.
Yes. And this is a medical facility, so it has exceptions as far as being able to provide the services you're providing. So that's not the issue.
No, we're not a medical facility. Actually, we're a
you're not.
Community center.
Oh, I see. Okay, so it's like a gym or a is
Yes.
it considered more of a gym? So you're at a limited capacity as we've identified. Again, I don't know how much room you have, but you certainly have it. I think we're at a 25% capacity through our order, right?
Yes.
Right. So I think that it's important to utilize whatever space you have to keep the people as far apart as you can. The stretching, I don't know if it's not too tedious, they can probably wear a simple face covering, probably not on the more strenuous activities, which you
Okay.
probably could put further away. But do the best you can. There's certainly testing options available for the people too before they come to make sure that everybody is negative and is safe.
Okay.
That's
Okay.
one option.
All right. Thank you so much. We'll
You're
see
welcome.
how it goes.
Yeah.
Okay, the next question was from Georgia Basile, and she does not have a microphone, so I'm going to read aloud her question. Is there any forecast as to when it will be safe for senior centers in Santa Clara County to reopen and provide, number one in-person or one-on-one social services to senior adults 60 and older, and provide, number two, congregate meals in dining room settings through senior nutrition programs? In the alternative, how long do you expect services at senior centers or congregate meal programs to be suspended?
Yeah, when we started this, we had no idea in which direction we're going. As I showed you those graphs, and we talk about opening, we all have to do as much as we can to keep people safe. The seniors, of course, are one of our highest risk groups, and although things are looking good, we still have people that are higher risk. So we just don't want to bring a lot of people at risk at this point together. It's just not safe. My dad is 93. He's living in Florida, and of course he's living at home. But I just am so worried about him coming into contact with anyone, and you just don't know who you're coming into contact with, because a lot of 30 to 40% of the infections are asymptomatic. And so I think we just have to be vigilant and cautious at this point and do the best we can until we can move forward. But we don't want to put anybody at risk, because this virus is still out there. It's still dangerous. It hasn't changed at all since the beginning. So we just want to remain as vigilant as we can.
Okay, and on that same question of congregate meals, another provider, James, is asking, what should the guidelines be in winter time? Is serve indoors at 25% or continue to serve outdoors to-go meals? And this is for shelters serving congregate meals.
Yeah, again, as soon as we come indoors, we have a much higher risk going on. And so if our weather works in our favor, then as much as we can do outdoors, the better. I just worry about that indoor, not good ventilation, a lot of people, and taking masks off is probably one of our highest risk activities.
Okay, and kind of going back a little bit in the chat, there was a question for colleges. The health order limits the inside meetings to 25% or 100 people, whichever is less. Can you confirm that colleges have an exemption to that restriction for instruction settings as long as they're maintaining proper social distance?
The school guidances, I haven't looked at the school guidance recently, so we can get back to that person if you can provide their contact. So, because I don't want to give a wrong answer, and those things have been updated and have changed, so I don't want to give a wrong answer. But let me be able to get back to that person with that answer.
Okay, thank you, Dr. Fenstersheib. Okay, anyone else? I'm not seeing any additional questions in the chat. We'll leave it open for a few more moments. I think an important link that Marcia put in there for you was a link to the social distancing protocols on the county website. COVID-19 page so that any of you who need to resubmit within 14 days can do so. A follow-up question about infants. Dominique, you had a follow-up question?
Yeah, sorry, I was trying to type it all out. One thing I've been trying to really kind of clarify is that, you know, we're serving many women postpartum, and so they have their very young infants. And when we talk about capacity limits within the building, I'm counting them as another individual. But at some point, I mean, before they're mobile, the mom and baby kind of come as a unit. I'm just wondering if there's any consideration around newborns and capacity limits.
Well, that's a good question. I have not heard that one before, and I'm a pediatrician, and I you know, I think to be super cautious, we've been certainly counting each living, breathing individual as an individual. So that's the way I would read it at this point. I can take that back and see if anyone else has a thought about that, but at this point, it's considered a separate individual.
Okay, that's great. Thank you.
Okay.
I'll follow up.
Rich Henderson is asking suggestions for meals, buffet versus serving plated meals to seated guests at the table. Rich, do you want to provide a little context for your question?
Just if we're going to have a gathering outside, is the suggestion to have a buffet that people go through, or just have someone serve them the meal, take it to the table, in terms of what's riskier?
Yeah, well, again, it's probably better to have those people that are going to be served just on outdoor, like in outdoor dining. It's all brought to them, unless you're picking up something to go. It's best to be separated like that, as opposed to being at bar. You know, it's like at a wine tasting bar.
Yep, we just lost your audio again, Dr. Fenstersheib. Yep, we lost your audio if you can hear me. Let's try to mute and unmute yourself again, Dr. Fenstersheib. We lost your audio, but I think you finished your remark.
Okay.
Anna, can you hear us?
Yep.
Okay, yeah, and we're out of time also, I'm sorry.
Sure. So thank you very much, Dr. Fenstersheib, and thank you, Molly, and for our participants today. If you have additional questions, you can keep putting them in the chat. We'll work offline with Molly and our Department of Public Health representatives to put together as many answers to the questions that you have submitted and get you that information. Thank you again, Dr. Fenstersheib, and I'm going to turn over our closing remarks to Marcia, our chair of our board of directors.
Great, thank you. And Marty, thank you again. We really appreciate you giving us your time today. And it's good to see you. Just a couple of quick things. If you, so this is places that you can stay informed to keep updated on COVID-19 information. In addition to that protocol link that we put in, there are some really good frequently asked questions there that gets updated regularly. So find them, and hopefully some of our questions will get added in there too. And then what's coming up next, Council of Nonprofits does this award ceremony every year, and they've added some new categories in order to recognize people that are really stepping up for COVID-19. The deadline is today, but if you could go to their link, to the Be Our Guest link, and you can submit. It's a very simple nomination form, so it doesn't take a lot of time, but it's worth throwing in the names of people that you've been working with that you think are really stepping up. And the Be Our Guest event is on October 23rd. It will be really fun. They have a bunch of people that are decorating pumpkins. That'll be, their photos will be shown and then auctioned off as a fundraiser. We're having on October 29th at 1 o'clock, Nicole Taylor from the Silicon Valley Community Foundation will be talking about philanthropy and nonprofit. So we hope you can attend that. Is that the last one? Oh, and we're going to keep putting this survey up until every single one of you fills it out. And we know who you are. So please go to the survey link. There's a short survey that's really quick, and start there. If you want to give more detail, you can go to the long survey, which takes about 15 minutes. But it's really important for us to gather information about how to support you with spaces as COVID-19 continues forward. And that's the end. If you want to give us feedback, there is a QR code on your screen that you can actually take your cell phone and put it up to the screen with your camera on, and it will grab that QR code and put a link that you can just quickly fill out in order to give us a little bit of feedback. So we'd appreciate that. Really appreciate all of you being staying till the end, and for signing in just to stay informed. We're all sharing information as fast as we get it. So I'm glad you are here, and thank you again. We'll close out now.